Hi everyone, my name is Joey and this is Haley. This video we're going to do a short video about psychosis, and I am going to be a provider and Haley going to be the patient in this video. And the video going to start now. Okay. Hi Haley,
Hi.
my name is Joey. I'm one of the NP students from Maryville University. I am going to do the initial assessment on you on this psychosis, on your conditions. Okay. First of all, can you tell me what bring you here?
Yeah, my family told me I needed to come in because I just can't sleep. I can't do anything because of all of these people watching me. I can't live my life this way.
Really? So when you say, "Oh, these people watching you," are they your family? Are they someone that you know or someone you don't know?
I don't know them. It's like the government or something. There are people in black suits that come in to my apartment building. I don't know them, but I could tell you, I recognize the same guy coming in, but that's all I know.
Okay, okay. And when do you actually, is that a real person or is that something that you thought about it, or what is it? Is that something you see?
It's something I see. My family says they don't see them at all. I've asked people, but I swear I see them.
Okay. And how long have you been having this seeing these people?
I think it's been more and more lately, but I don't know. It feels like over the past year or so, maybe
Years? You mean like
I
one
don't
years or 9 years? A big difference.
maybe like one year.
1 year. So start 1 year ago. Have
Uh-huh.
you have any medical history, any history before?
No, this is no, there's been nothing wrong with me.
Okay. Are you taking any medications?
No.
Not at all. Okay. Okay. And when you uh how often do you see these people?
I think it's every day. I would say it's every day when I leave my apartment, there's someone there.
Okay. So what, so you see them every day. I'm so sorry. I'm sorry guys, everybody. Pardon my dog. Someone moved the room. And it's happened every day. It's happened every day. Does it happen all day or just specific time?
Well, seeing people happens when I go outside, but when I'm at home, I hear things too. So it's almost all the time that I feel like I'm being watched and being listened to.
Okay, you feel like being someone being watching you, and you also hear something too.
Yeah.
And when you say you hear things, is that the people that you see that talk to you, or actually different voices?
I think it's the people outside, but they find a way to kind of get into everything. Like I hear them on my phone, I hear them on the TV, and they're talking about what I'm doing. So it's like they're surveilling me and talking about what I'm doing.
Okay. Did I tell you to hurt yourself or other people?
No,
No. Okay. Okay. And it's happened every day, all day long.
pretty much.
What about when you're sleeping? Do you have any nightmares?
I have nightmares about the men in suits coming in my apartment. Yeah.
Okay. And then do you wake up during the night?
Hmm.
How many hours do you sleep?
Probably, it's like it's fitful sleep, so I'm up and down throughout the night. So maybe like 3 or 4 hours a night of
3 or 4
sleep.
hours a night with nightmares?
Most nights nightmares, yeah.
Okay. Does it interfering with your sleeping pattern, would you say?
Yeah.
Okay. Any anxiety? You feel anxious at all? Any anxiety, palpitations, anything like that?
Yeah, once I hear that the voice talking about me, I get pretty on edge and my heart races. I feel shaky, like I feel like I need to run away.
Okay. Okay. And that's also happen every time you see these people, or is that only once a while?
I would say pretty much every time I see them because just getting so it's like getting worse where it's just in every aspect of my life.
Okay. What about depression? You feeling any sadness, any unmotivations, or lost interest in things, feel crying out nowhere?
Maybe I haven't been really talking to people much because this is just so overwhelming for me. I feel like I have no interest in anything I feel like because of this uh interruption in my life. I don't have any interest in doing anything because this is just taking all of my energy.
Okay.
So I don't know if I feel sad. I feel overwhelmed and
Okay. Okay.
yeah.
Uh, okay, so over at this point, I'm going to stop this video for a little bit to talk to you guys about. According to with on a normal clinical visit, I would activate doing a PHQ-9 or a CAS-7, and a CAS-7 actually both because she does have anxiety depression. I would activate that scale, but because we have a limit time to do the full initial assessment, so I'm just gonna give her a score. So I would say with the anxiety she have, I would say she have anxiety, her score would be 15, and then her depression score is 15. So actually it's pretty high there that because of the hallucinations that she's gonna have. Okay. So the next one is I'm gonna continue a video now. Okay, tell me a little bit if you have any trauma before?
Do you mean like abuse? Like have I been
Yes.
abused or
Any
something?
trauma abuse? Were you into some situation that you actually get really scared about?
I mean, I would say as a kid, my parents weren't very nice to me. My dad was physically abusive. Um, but that's probably it.
And what do you how old were you was that happen?
I mean, it was like for a while, it was probably like I was the earliest I can remember, maybe I was like 6.
You were 6, and then how long does this abusive relationship last?
A few years, and then my parents got divorced. So I don't know, maybe I was 10 by the time he was gone. Yeah.
It was about 4 years. So during that time, do you have any episode of anxiety, depressions, or anything like that during that time?
I was pretty afraid of him, so I was pretty fearful as a kid. I don't think I was depressed. Otherwise, things were okay, but I did kind of keep to myself also.
Okay. And you were stable after 10 years old up until a year ago.
I don't really remember anything otherwise bad in my childhood. I mean, I was, I again, I still kept to myself past that. But no, there wasn't anything major other than that.
So would you say when you seeing these people or hearing these people talk about things, was it related to the argument between your parents, or was it just like telling you to do like just talk out of like no meaning at all?
I mean, it's like they'll report on what I'm doing and then they say I need to um it's like I'm in a mission or something. Like
I
there's a
see.
mission that I
Okay.
need to do.
So it would have nothing related to your past trauma with your parents. Okay. I just like to know to see if it's connected or what cause of it.
Yeah.
Okay. And okay. How do you are you able to focus? Yeah, you cannot focus. Okay.
No,
You're not able to complete tasks.
not really. It's just like it's on my mind all the time because I don't know. I'm always on edge about when am I going to hear something or when am I going to see someone. So I really can't.
Okay. So through this experience, do you have any thought of hurting yourself or other people?
I don't want to hurt someone. But sometimes I feel like I'm so fed up with what's going on that maybe it'd be better if I just didn't have to, like if I just could sleep and not wake up kind of thing.
Okay. So do you get like impulsiveness? Like
Mm,
suddenly you just like to hit somebody or you just anger out of nowhere?
not usually. I mean, I get angry sometimes at the people I'm seeing, at the men in suits. Like I do feel like eventually, what if I retaliate against them or something, but I'm not yet. I'm too scared.
Okay. So okay. So I asked you this question earlier. You said that this is I'm going to go over a little bit about your medical history and your family history too.
Hmm.
Anybody in your family had any medical conditions or psych conditions or mental health conditions?
Um, yeah, there's not any major medical history in my family that I know of, but I know that my dad seemed to have some problems and he was in and out of like a mental hospital. He was really, aggressive.
Okay.
I don't know what he had, but I think he seemed to be really mistrusting of people.
Okay. Trust is truth. Okay.
Yeah.
And is your father the only person that had mental health condition in your family?
My mom has anxiety, I think,
Okay.
maybe from him, but
Do you have any siblings?
no, no siblings.
Okay. Okay. And have they ever and you was never diagnosed. Okay. And who do you live with? Are you living by yourself?
I live by myself.
And what do you do?
Right now, I'm not working. I had to quit my job, but I used to work at a bookstore. I was just a cashier.
Okay. What's your higher educations?
I graduated high school. I started to do community college, but I couldn't really finish because that's right about when this stuff started happening.
Okay. So this start happening mean it's just started last year, right?
Yeah.
Okay. Do you have any medical history?
Mm,
No. So never diagnosed anything with medical or mental health. Right? Okay.
no.
Do you use any drugs? Cocaine, marijuana, heroin?
I did use some marijuana in high school, but I almost feel like it just made me really anxious.
Mm-hmm.
So I didn't use it for that long after that.
Okay. So no reason use marijuana, smoking, or any cocaine, any drugs.
No.
Okay. Any alcohol drink any alcohol?
Sometimes if I can't sleep, I'll have a couple beers to help me sleep. Uh, and sometimes if I just have nothing going on and I'm hearing the voices and they just won't go away, I'll just
Mhm.
drink. Um, I don't
Okay.
know. It's like maybe 2 or 3 beers a day.
Okay. Okay. And okay. Have you, I know I asked for now, have you ever attempt suicide before or hurt yourself before or cut her?
No,
No? Okay. And were you never on any treatment, anything like that?
no,
Okay. Have you ever gone to a therapist?
no.
Okay. With this exam, mostly we are going to observe the patients, but I'm going to just read it through because this is a video. So over my observation, her appearance is well-groomed and collective and calm. Her posture is within normal limits. She have good eye contact. She is her oriented time for. She is cooperative and have good attitude with good posture, positive cooperative with the provider. Um, okay. And her speech is clear and fluent with soft tone. Her mood, her mood is calm. She able to answer all questions appropriately and appropriate effect to the facials. There's nothing particular that we need to concern about. Um, She does have some paranoia because seeing thing and hearing thing on daily basis and frequently throughout the day. She does have both auditory and visual hallucinations with that, but with the exception that no, they did not tell her to hurt herself or other people. Um, she have good perception that she knows she actually hearing things, seeing things that is not there. She does not have any suicidal thought, does not have any thought harming other people. She does not have any delusions, even though hallucination is part of her exam today. She do have good insight and good judgment because she aware of things happen around and she seek for help. So that's pretty much conclude my mental status exam and also conclude my video for a 2-day visit between a psychosis patients and as a provider. And I'm going to hand it out to Haley, be the provider, and I'll be the patient's next video from her part.
Okay.
Thank you, everybody.